हेलो अस्सलाम वालेकुम दोस्तों। आज मेरे साथ उसामा मुनीर हमारे दोस्त हैं ऑस्ट्रेलिया से, जो कि डॉक्टर हैं और फेसबुक पर पाकिस्तानी डॉक्टर्स इन ऑस्ट्रेलिया के नाम से एक ग्रुप रन करते हैं। वो उसके एडमिनिस्ट्रेटर भी हैं। आज हम उनसे बातचीत करेंगे कि ऑस्ट्रेलिया में जो मेडिक्स या फ्रेश मेडिकल ग्रेजुएट्स हैं उनके लिए क्या जॉब के मौके हैं और क्या पाथवे है, किस तरह से वहाँ जाकर अपने कैरियर को शुरू किया जा सकता है। अस्सलाम वालेकुम उसामा, कैसे हैं आप? ठीक ठाक?
वालेकुम सलाम। जी बिल्कुल ठीक ठाक, शुक्रिया।
Osama, first of all, thank you very much for running this group, which is really very helpful for the people who are looking to move into Australia. तो लेकिन उसके बावजूद बहुत से लोग हमसे सवालात पूछते हैं ऐसे, जो शायद उनको लगता है कि उस ग्रुप के थ्रू भी उनकी वो जो सवालात हैं वो एड्रेस नहीं हो पा रहे। तो इसलिए मैंने सोचा कि आज हम ये इंटरव्यू कंडक्ट करें। जो पहला सवाल अक्सर हमसे पूछा जाता है कि एक जो फ्रेश मेडिकल ग्रेजुएट या एक नया डॉक्टर जो पाकिस्तान में या इंडिया में कहीं से भी ग्रेजुएट होकर निकलता है, हाउ ही और शी शुड गो टू ऑस्ट्रेलिया, व्हाट इज द प्रोसेस टू स्टार्ट विद?
So first of all, the fresh medical graduate who wants to appear in AMC exams, he need to have MBBS degree. So that is the most important thing. So sometimes people say that can they appear in the exam just while they are doing medical, like they are in second year or third year, just like people can do USMLE. So that is not possible. They should have MBBS degree. After that, they need to go on www.amc.org.au, and at the start there is a cursor which says apply online. So they need to apply online and create their account. Once they create their account, AMC will ask them for some documents which they have to send. Most important is their MBBS degree. And the reason for this registration is that AMC will need to check if their degree is authentic or not. Um, this process takes about 2 to 3 months, depending upon different universities. So, if you want to do this, you need to apply soon. They will also ask for your proof of identification like passport, driver license, or debit card. Um, but the most important thing is MBBS degree. Uh, these documents need to be attested. In Australia, they can be attested by Justice of Peace or Notary Public. In Pakistan, the easiest way to get them attested is Notary Public. You can find a Notary Public in your local courts. He would do this certification at very cheap price. Uh, After that, you need to send the document to AMC, and the fees for this AMC verification is $500. This is not the fee for notary public attestation. Notary public is very cheap, but the fee for this making this up verification from AMC and EICS is $500.
ओके, सो जो आपकी बात से मैं समझ पाया हूँ उसामा, मैं अपने दोस्तों को भी क्लियर कर दूं कि हाँ, एमबीबीएस की डिग्री कंप्लीट होना शर्त है एएमसी एग्ज़ाम में बैठने के लिए। हाउस जॉब के बारे में क्या कहेंगे? वो भी ज़रूरी है एएमसी में एग्ज़ाम में बैठने के लिए?
Uh, जी आपने बिल्कुल सही कहा कि MBBS की डिग्री मस्ट है, but house job as far as I know is not mandatory. It is indeed not mandatory to appear in exam. You can appear in AMC exam after you have done MBBS, but you have not have any experience.
ओके, व्हाट अबाउट द आइल्स रिक्वायरमेंट, जो कि बहुत लोगों का सवाल होता है कि आइल्स के लिए क्या किया जाए और रिक्वायरमेंट क्या है, क्योंकि ये चेंजेस आती रहती हैं। तो इस वक्त की क्या रिक्वायरमेंट है?
IELTS is not required to appear in exam, but IELTS or OET is required to get a job in Australia. So you can appear in exam in AMC exams without IELTS or OET, but you need to have at least 7 band in each of IELTS module, each, not as a total. I'm saying again, in each of the module you should have at least 7 band, or if you are giving OET, which is occupational English language test, you need either B or A in each of the modules. but it is not required for appearing in exam, but it is required for getting a job in Australia.
And what books would you recommend or advise to prepare for the AMC exam?
For AMC MCQ, I will advise people need to decide which is their most important book. I have seen people who have passed the exam by studying Kaplan USMLE Step 2 lecture notes. It's Step 2, so final year subjects. It should be on your fingertips from A to Z. Or the other procedure is you study John Murtagh General Practice. It should be on your fingertips. You have to decide which one is easier for you and which one you are more comfortable with. People pass by reading both these books. You have to decide. I completely read all the Kaplan USMLE Step 2 lecture notes and some selective things from John Murtagh General Practice, which are not available in Kaplan USMLE book. That's the advice. And I will also add that there are some MCQ books from Australian Medical Council which you should study. The name of the book is AMC MCQ Handbook, and there is also an older book from AMC which is called Annotated MCQ. And one more book, you just need to do the pictures from diagrams from that. Sometime pictures from that book can come in MCQ exam, which is called Anthology of Medical Conditions. Anthology of Medical Conditions. Just do the pictures from that book. And for AMC Clinical, you have to do AMC Clinical Handbook, which has about 150 cases, and most of the time, out of the 16 stations in the exam, 4 or 5 are from the book. So you should do it thoroughly. And secondly, if you can get, you need to find VMPF notes. If you can find them, they are also very helpful, and they have covered almost everything that could be done. Other than that, I will advise people to check the YouTube videos of Tele of Corner clinical videos, which tell about different examinations. Some people feel that they are kind of they are not detailed, so I will advise them they can also see McLeod clinical examination videos on YouTube. They are really helpful.
Okay, once somebody has passed the exam, in the UK, the process is after getting your exams done, then you have to apply for the GMC registration. What's the process of registration in Australia? How they gonna apply for the AMC registration after the exams are done?
In Australia, you need to have a job to apply for registration. Without job, you cannot get registered with APRA, which is Australian Health Practitioner Regulation Agency. So once you have passed your MCQ exam and IELTS or OET, you start applying for the jobs, as much jobs as you can. Don't think that you are um, this job is senior to you and you cannot get this post. I have seen people who have found senior posts with very limited experience back home. So I would suggest that people need to apply for these jobs as much as they can. If someone joins my group on Pakistani doctors in Australia, we have a file section. And in the file section, we have all these websites on which they can apply for these jobs. So once you have found the job, then you can only apply for registration.
Osama, one more thing, which I have personally seen the candidates coming from India and Pakistan, their resume or the CVs, they are not up to date. The way they should make it to apply for a job, to get a job or residency in Australia or America or Canada. What would you advise on that? What particular things they need to bring up in the CVs to make it look better to when they apply for a job?
Uh, I frequently check the CVs of different people who send them to me for feedback. And the most common mistake I have seen in the CVs is the English language is not up to the mark. As you all know, English is not our first language, so we need to be very careful about that. There's no grammatical mistake, there shouldn't be any spelling mistake, and if you think you are not confident in making your CV, get a professional to do it. It will pay you in the long run. Um, Other than that, the CV should be in a good format. Sometimes people have CVs which are 7 or 8 page long. No one has time to read that 7 8 page long CV. So your CV should be maximum 3 pages long. You should try to have all the CV in a single format. So you should not have you should not use 2 or 3 different formats like or fonts in the same CV. Usually Times New Roman and in size 11 is a very good format, and it is enough. Uh, Try to have all the CV in one single format. Putting the information in tabulation form also decreases the size of your CV, which is also good. Uh, Now, after that, the people from West like to see research or you attending some workshops or continued professional developments or attending seminars or doing some audits. So all these things and courses like advanced life support, basic life support, cardiovascular life support are very good. So these things will make your CV strong.
Okay. Now come to the practical points. Once they have done their exams, they've got the AMC registration, they've got a job offer in Australia. I mean, there's a difference between a RMO job and getting a residency or the trainee job. So, if somebody is going to come Australia, what he or she should do to get a residency in Australia? I mean, not a RMO ship job, or what is the basic process to start with to get into that system?
The mandatory requirement to get a trainee post is general registration. Now, the minimum time you can have in Australia before you can get general registration is at least 1 year. The process of general registration is that you have passed AMC clinical, not MCQ, AMC clinical, plus you have 1 year general rotations in Australia. By general rotations, I mean you should have worked at least 8 weeks in emergency medicine in Australia, 10 weeks each in medicine and surgery separately, and some other term in Australia. So the total of that should be at least 47 weeks. So you should have done AMC clinical as well as general rotations to get general registration. Once you get general registration, you need to apply to the college you are interested in. So if you want to become a psychiatrist, you apply to Royal Australian and New Zealand College of Psychiatrists. They will hold interview and then they will decide whether you can become a trainee or not. Or if you want to become a GP, you apply to their college. So the mandatory requirement is general registration, which means at least 1 year general rotations in Australia and AMC clinical.
So, how many times in a year one can apply for the training post? And is there any particular website for that college, or is it like a match program in America? How it works then?
Uh, it's not like America because you have to apply to whatever college you are interested in. Um, Different colleges have different number of time they take trainees, but usually they are 2 to 3 times a year. Like in Royal Australian and New Zealand College of Psychiatrists, they have interviews twice a year to take trainees, usually in September and February.
Okay. Once somebody is in Australia now, their main question again will be, I mean, what is the expenditure in Australia for a couple at least? And how much is the basic salary for a junior doctor on the per annum basis? And how much they can save?
Uh, This question is quite common, and we get it quite commonly. Now, junior doctor salary is at least 4,000 Australian dollars per month after the taxes. 4,000 Australian dollars per month after taxes. The pay is slightly higher in Western Australia, which is one of the states, but still at least 4,000 Australian dollars per month. Now, depending upon your way of living and also where you are living, the expenditure varies a lot. So, if you are living in a rural area, you don't need to spend much money. You can spend very little and get everything done. But if you are living in cities like Sydney or Perth, then the expenditure would be more. Um, for a couple, at least a couple in city should save at least $1,000 if they are after every month, and if they are living in rural areas, they can even save more than that, like $2,000. Uh, for a single person, they can save even more than that, much more than that.
Right. Osama, is there any other pathway apart from the AMC exam? Anybody can get Australian Council registration without giving these exams.
Now, one pathway is competent authority pathway. Uh, Now, what happens is people who have passed PLAB and have some experience in England, or people who have passed all the steps of USMLE plus have some experience in USA. Now, this some experience is ranging from 1 to 2 years. It is given clearly on AMC website exactly how much experience they want from which country. Then you can apply for limited registration in Australia on the basis of those exams. This is another pathway. Another pathway is specialist pathway, but this is only for people who are specialists. But I would like to clear one thing in specialist pathway. If you don't have Western experience, it is almost nearly impossible for you to get a specialist post in Australia straight away. So if a person has done Pakistani or Indian specialization and they don't have Western experience as a specialist, then if they apply for Australian specialist colleges, they may exempt them from 1 or 2 years of training and they say, let's do the remaining training as a registrar. Or you may have to appear in exam, or you have to do at least something before you can become a specialist in Australia. It is nearly impossible to become a specialist in Australia without Western experience.
Osama, just to clarify for the viewers, I mean, can they apply on the basis of FCPS, which is a Pakistani fellowship degree? They haven't got any MRCS or MRCP done, but they have got only FCPS degree. Still, can they apply through specialist pathway or area of need pathway?
They can apply through specialist pathway, but again, the thing is, they will not get the job as a specialist straight away. Depending on their experience, their record, their results, and their interview with the concerned college, the college will decide whether they will be exempted from 1 day or 1 year or 2 years or nothing at all. It differs from case to case basis, but at least they have to do something before they can be taken as a specialist.
Right, okay. And what about area of need pathway? Can you elaborate something more on that?
Now, the area of need pathway is really non-existent at the moment. It was previously, but at this moment there's nothing much happening with the area of need pathway. So that remains the case.
Okay. And as you said that after doing PLAB and USMLE, they can apply for the AMC registration. Any other exam, in your opinion, which can help them to get through the AMC registration and come to and work in Australia?
Uh, Now these are the two exams. I believe there. I'm not 100% sure, but I think there is a Canadian exam as well. But it's not just the exam clearance, it has to have with it some
Some
experience in
experience
that country,
in that country.
which,
Okay.
which can be 1 or 2 years at least.
Now,
The complete list of the countries and the exams is available on AMC website. So if people go to amc.org.au and click on competent authority pathway.
okay, Osama, one more question. As I have gone through this process, so many time people they discourage you not to come to Australia, to UK, to Canada, America. The people who are living there, they always, this is what my experience is. I could be wrong. People discourages you not to come because there's saturation, oversaturation, there are no jobs, no residency. This is always has been the case, but still, I didn't listen to those people. I came here and got the training job. What would you advise in that context to the newcomers who are just going through their final years or doing house job at the moment?
No, it depends upon your passion. If you are passionate about this and your goal is to come to Australia, I will say do everything for it. Every day I hear success stories. Depends a lot on luck as well. Some people get immediately after doing AMC MCQ only, and some have to wait some time. But in the long run, if you are passionate about it, I will say do it. People keep on getting it. One of my friends just got a job last month. Another person got a job this month. Uh, so people keep on getting it. People are getting trainee posts. There are some specialties in which it's more common for international medical graduates to get the training post. One of them is psychiatry. We see a lot of international medical graduates in psychiatry. GP training is quite common. Then emergency and ICU is quite common, and medicine training. Uh, the situation with surgical training is, of course, very difficult, and but people are still getting job in other fields.
Right. The last we're going to summarize, and before that, one more question regarding immigration. Once somebody is working in Australia, in what time he or she will get the PR and the naturalization, the passport?
Now, the permanent residency, the mandatory requirement for permanent residency for a doctor is having general registration in Australia. Once you get general registration, you are eligible for PR, you can apply for PR. The minimum time which you need before you can get a general registration is at least 1 year. So if a person gets general registration in just 1 year, he can apply for permanent residency straight away. Now, the permanent residency application period differs a lot. It differs from 1 month to 6 months or 1 year, but within 2 years of that application, almost everyone gets permanent residency. Sometimes your employer or the state you are working in is more than happy to sponsor you for permanent residency. In that case, you can get the permanent residency in just 1 month of application. But once you apply, usually people get it within 6 or 1 month, 6 months or 1 year. Sorry.
Osama, somebody told me that one can apply for the immigration in Australia being a medical person if they have got some experience and degree in the administration, hospital administration. Do you know anything about that? Do you want to add up anything in that?
As far as I am aware, it is not the case. You have to apply for a doctor. You have to apply through the medical pathway and get general registration.
All right. Thank you very much, Osama, for this interview. It is much appreciated. I hope the people who will listen and view this clip, they will get a lot of information. And obviously, we will be helping them through these kind of videos. And they need to join your group, Pakistani doctors in Australia, to get further info there. Thank you very much, Osama.
Can I just add a few more things before we finish?
Sure.
Now, just quickly to tell, AMC MCQ exam has 150 questions, 120 are marked, and 30 are just for survey. But no one knows which 30 are for survey, so you need to do your best. Medicine has 35 questions, surgery 25, obstetric and gynae 15, pediatrics 15, mental health 15, and population health 15. And other than that, I will just add one more thing about one thing is called PESCI, pre-employment structured clinical interview. This is for people who want to go to GP pathway but who don't have general registration. Um, they need to appear after AMC, MCQ, and IELTS or OAT. They need to appear in this interview, in which they ask about 5 different scenarios, and they get the response from person. And one thing quickly, the specialization time in Australia, depending upon specialty, is from 4 to 7 years. Uh, the emergency training is 7 year, and the GP pathway is 4 years. Psychiatry is 5 years. I think that's all which I want to add. And thank you for giving me this opportunity. Again, I'm more than happy if people would like to join Pakistani doctors in Australia. We are an active group of about 5,000 people, and they can put up the question, and we will be more than happy to help you. Thank you.
Thank you very much, Osama, as well. So, here I'm going to conclude this interview, and we will be bringing in some more interviews for you from different parts of the world, from different professionals to help you out, guys. Thank you very much. Bye.